Are we recording?
Yeah, it's been recording since I
The vision of the world of healing is to discover, celebrate, and reveal different types of healing techniques, systems, and philosophies. By exploring and honoring these different practices and healing beliefs from around the world, listeners will be able to learn more about different cultures and be exposed to ideas that they may not have heard before. Our vision is to expand the listener's mind about what is possible in the world of healing, while at the same time helping people realize that we are more similar than we are different. This is the World of Healing with Dr. Vanda Corbett. On today's show, we welcome Dr. Robert Corbett, a doctor of chiropractic practicing in his 44th year in Alberta, Canada. He has an unwavering passion for the art, science, and philosophy of chiropractic. And when he speaks, you can tell that he is a true chiropractic warrior and guardian of the spine.
Welcome to the World of Healing show. I am so excited today to introduce you to my guest, my dad. This is Dr. Robert Corbett, and he's been a chiropractor for the last 44 years here in Alberta.
Yes.
And he's the other half of the reason why I am a chiropractor today. You met the other half of the Bob and Joe show, and this is the original B.O.B. So, Dad.
First of all, thank you for having me this morning.
You're
It's
welcome.
nice to have an opportunity to discuss the wonderful world of chiropractic and how we've been able to help a lot of people as we move through our time and ages.
Yeah, absolutely. So tell me, let's go way back to the beginning. How did you become a chiropractor?
Well, that's quite a story, actually. I was injured as a child. I fell off a bike on my head and had suffered severe migraine headaches for a great number of years, and then went off to school after high school and into post-secondary school, and met your mother. And of course, she and I had discussed chiropractic, believe it or not, and as a other profession. We were in other professions. Your mother was teaching, and I was in the engineering world. So we came to the conclusion that for our own health benefit, that we search out other means other than the regular medical approach, which we had not received any benefits from. So we decided to enroll in the world-famous Palmer College of Chiropractic in Davenport, Iowa. And we motored there, a couple of young kids, married a few years, and traveled to Davenport and became students at the Fountainhead of Chiropractic.
Good old Davenport.
And of course, you know it very well. You've been a student there.
Also a graduate.
also a graduate. While we were there at Palmer, we had an opportunity to sit at the feet of many of the great chiropractors of the time.
Yeah.
To name a few, Dr. Gonstead, a very famous chiropractor and an excellent chiropractor who helped many thousands of people.
Yeah.
Dr. Clay Thompson.
Of course, Thompson technique.
Dr. Ian Toffness.
Yes.
Dr. Goodhart.
Applied kinesiology.
Kinesiology. To name a few more, Dr. Blair. So a whole plethora. Dr. Desjarnette was another
SOT,
one, a very famous SOT technique. So we had an opportunity to enrich our knowledge in the technique of chiropractic, as well as receive what I consider to be probably one of the finest chiropractic educations in the world.
Yeah. You were there at the golden age
there.
when everybody, all the techniques that I studied, you were there with the founders and the developers.
Exactly. We graduated in what I consider to be a very gracious time and knowledge, and we were able to expand our armamentarium once we graduated and started practice.
Yeah.
And we started practice in 1975. So I've been practicing, for 45 years. So that's a long time.
one or two. One or two more than me.
Chiropractic has helped me personally through my health challenges that I've had.
Yeah.
I had a very serious car crash before we went to chiropractic school,
Right.
and had some rather severe fractures in my neck, and which precipitated to again searching out why am I in this why I'm in this predicament and how can I best find a solution.
Yeah.
And your mother, of course, had some severe back problems as well. So we were very grateful to be able to attend Palmer College as students, and not only that, but receive and gain our health back, which was a wonderful, wonderful.
Not only were you
benefit.
there learning, but also healing yourself.
Exactly.
Yeah.
And if you read back in the history of chiropractic, a lot of the students who went to Palmer College, which was the foundation and the fountainhead of chiropractic, went there for several reasons. The first, of course, is to learn chiropractic. The second was to improve their health, because a lot of the students had health issues that had gone through the regular medical regimen and had not received any real benefit to care.
Yeah. Well, what I found from doing the show, it really doesn't matter what healing art somebody is doing. It's usually they go into something that helped them personally, or they have a really huge personal story with, whether it helped their mother or their brother or their father. So it's interesting. It usually seems to be the way that people find alternative therapies, is because that's what's really actually was their path back to recovery and to health.
Exactly. Yeah. True. I found out in the last 45 years of practice that when we started practice, when your mother and I started practice, things were not as complicated chemically in the world as there was today.
Yeah.
We would see patients a few times and would show marked improvement in the quality of their health.
Yeah.
Today, because of the interference brought about by the chemistry, the overuse and abuse of medications, we find the challenge in that helping patients, we have to really dig deeper as to find out why they're ill.
Yeah.
Is it a chemical imbalance? Is it iatrogenic, caused by the doctor, words or deeds or whatever?
Yeah.
Or is it their lifestyle? Is it their lack of exercise? Is it their diet? Is it the stresses that they have in the world today? An example being, we see a lot of young people today coming in as patients with headaches and upper shoulder problems. Well, we now realize we have a dilemma called dropped head syndrome, which is a result of kids sitting day and hours by hours looking at their
phones like this.
At their cell phones.
Yeah.
And of course,
well, we also call it text neck.
Okay, tech neck. Okay, new name. But it's true. And of course, these kids come in and their posture has been challenged because they spend more time on the video games rather than out running in the yard.
Yeah.
Or playing as kids do.
I'm just going to interject a little learning thing for everybody out there. So for every degree that your head goes forward, it's an extra 1 pound of pressure on your shoulders. So if the average person reads their cell phone at this angle, as you can see, this is a 60-degree angle, and that is like wearing a 60-pound backpack on my shoulders, right? So every degree you go forward puts extra stress on your neck. Exactly. So, I mean, and not only that, for every, what we call anterior head posture, I can do this here, but where your head goes forward like this, you see a lot of people like this, right? For every 1 inch that you go forward, it's another 10 pounds of pressure. So with your physics as your engineering background, of course, if you go forward and down, just imagine the stress that you have actually on your neck.
Exactly.
Little learning moment for you.
Absolutely, and it's very, very true. And we find that a lot today with the young. Of course, the young people are not exercising as they should, nor are the older people.
No, it's true.
There's the population in North America is around 400 million people, and statistics from the World Federation of Chiropractic and the various colleges have presented a number of 10 to 12% of these 400 million people wake up every morning with low back pain.
Really?
So that we're looking at 40 million people every day wake up with low back pain.
Yeah.
So they present themselves to our office and say, "Doc, what am I doing? What was going on?" Well, of course, when we examine a patient or when a patient presents themselves to the office initially, we do a pretty extensive investigation as to why they're here. And you can appreciate the fact that we do a case history. We do an orthopedic and a neurological exam.
Yep.
We do, if necessary, imaging studies, whether it be X-ray or an MR or a CT scan. And then we sit down with the patient after we've compiled all our records, all our information, and review them with the patient and say, look, this is what the problem is. This is why you're at this position in time. We can either help you or we can't. So if we can't help that patient, we refer them off to another specialist, whether it be an orthopedic specialist or a rheumatologist or whatever it might be. In most cases, we find that low back pain is a lifestyle thing. Not only that, but it's a result of aging. We all age. As you know, your father's aging, right? Thank you for that. And when you were 18 years of age and you reach 65 years of age, you're an inch and a half shorter. And that's a result of the degeneration of the discs. So when people present themselves to the office with low back pain and they're 65, 70 years old, why am I having this low back pain, doc? I got this pain in my low back. Well, it could be genetic, could be a genetic problem, or it could be just the wear and tear and aging. So we find that with chiropractic, whether we use manipulative technique, hands-on technique, or we use the new computerized analysis and computerized assist adjusting procedures, that we're able to free up the area of the low back syndrome and allow and regain some of the movement that they require to balance out their normal life. And I guess we also insist that they do some form of rehab, whether it be walking, swimming is great, aquasize, any type of stretching that they may have, or they can go into an exercise class and learn how to essentially rehabilitate themselves. So it's a lifestyle change. It's not necessarily, here I am, here's this, I get this all the time.
I know what you're going to say.
Here's my body, doc. It's on a Tuesday. Here's my body, doc. I'll be back Thursday to pick it up. So that doesn't happen. A lot of people have the idea that chiropractic is a quick fix, which it isn't. We're
not Tylenol.
Exactly. In medicine, they deal with symptomatology. And the symptoms, of course, drug A, symptom A, drug B, symptom B, come back Thursday, we'll give you drug D. So as a result of this symptom treatment problem, we have now gone into a whole new era of what we call the opioid crisis. And the opioid crisis was created basically by the pharmaceutical and medical profession.
Well, and all that's coming out right now as far as the drug company that created it and then the drug company that created the solution to the problem.
Exactly.
And
chiropractors stand on the edge of protecting the patient against further opioid crisis in the management of the opioid crisis. The medical profession does their best when they do good first aid care. They're well-trained people, they're well-educated as a chiropractic profession, but when it comes to the treatment and management of pain, they're low on the list. And the only armamentarium of support that they have is drugs. So the opioids, of course, like oxycodone, fentanyl, all these different drugs that are given to the patient have a limited usage time. So what happens is people say, I went to my doctor and I got drug for my low back pain, but as a result of same, they become addicted.
After about 4 days.
After 4 or 5 days, they go back to the pharmacy and the pharmacist says to them, well, Mrs. Jones, we cannot renew your prescription because of the risk factors of addiction.
Absolutely.
Well, that's fine. So what do? They're dangerous. They're especially, exactly, they go to the street and they buy the drug off the street vendor. And of course, in most cases, it's an illegitimate drug. It's put together in a back room somewhere, and it's laced with other types of chemicals, and of course,
or carbutanol, which is elephant tranquilizer,
whatever it might be, and they die. So now we have a opioid crisis where people are severely handicapped they're in a dilemma. They're afraid to take the opioid drugs, but now they're turning to chiropractic care because we're seeing a lot of patients now who come to the office and say, I tried the drugs and it doesn't work, doctor. What can you do to help me? And of course, with chiropractic, with the procedure of chiropractic, which is a non-invasive, dangerous, non-surgical, non-drug approach, people realize after they've attended the office for a few times, they, wow, where have I been all these years? Why wasn't I here? Why wasn't I in this office 5 years ago?
And when they come in, they're like, oh, you were the last resort.
For some reason, there's been a stigma about chiropractors because chiropractic is based upon the art, philosophy, and science of neuromusculoskeletal.
Yeah.
The spine is the chiropractor is the guardians of the spine.
Ooh, I like that.
And what we do is we, as guardians, maintain the integrity of the spine. And if you maintain the integrity of the spine, you maintain and will help the patient's health.
100%. It was Thomas Edison, wasn't it, that said, look to the spine for the cause of disease.
Exactly.
Yeah.
And as some of the famous chiropractors of the time, like Dr. Gonstead would say, we have what we call a subluxation in the spine, which is an involvement of misalignment of the spine, usually causing neuromusculoskeletal disease, D-I-S-E-A-S-E, not disease.
Not disease, lack of ease.
Exactly. Yeah. Find the subluxation, adjust it, and leave it alone.
Absolutely.
The body, which is the has the innate ability to heal. No doctor, whether they're a medical doctor, a psychologist, a chiropractor, any kind of a physician, never healed anything. The body does the healing.
Absolutely. 100%. High five. Now, for people that know me, this is where I get it from when I get on a roll.
Well, thank you for the opportunity. This is the longest that Vanda has been quiet. It's
because
years.
I'm mic'd up. It's like,
right. For sure.
Yeah. Well, what kind of, we talked about the type of patients you find and stuff like that. Have you, I don't want to ask like who your favorite patient is besides me, obviously. But like who's been an interesting challenge that you've worked with over the years or?
Oh my. You realize that between Dr. Joanne, your mother, and myself, that we've seen over 50,000 new patients in the last 45 years.
I do realize that.
So that's a tremendous number of patients.
I've seen the paper in the file boxes.
Yeah. So when you say what is your favorite patient,
in general.
In general, I enjoy the kids.
Yeah.
I enjoy them. It's fun to visit with children because they're so innocent.
Yeah.
And they're growing spines.
Yeah.
And that's the where people really should consider looking at caring for their children, because you often see a child will come in and there'll be a bedwetter, or they'll have headaches or stomach trouble, and it's usually as a fall or whatever it might be as a result of trauma. Kids are climbing on everything. Well, not as much today as they used to.
Yeah,
but
now
they're protected now. They have bumper pads and everything going on now. But in the old days, we used to jump off tires and roofs and whatever. And of course, injure our spines and fall off bicycles.
Yeah.
And so now we have the situation where children come in and they have some health challenges. Yeah. So when a child presents themselves, we always be very cautious of finding such things as a scoliosis, again, postural problems. And we're always trying to teach the parent, look, get your kid in here for a regular check, for a spinal check, so that we know how this child's spine is growing.
Yeah.
Parents will come in later on. Older people say, I wish that my mom and dad had sent me to my chiropractor or to a chiropractor so they would have the opportunity to have the spinal health that they have, or the lack of spinal health that they had, so they can live a joy of pain. Pain, as you know, Dr. Vanda,
yes, Dad,
is the motivator. Is the motivator.
Pain and money.
Pain creates action. There's two great things in the world that people are afraid of, and pain and fear, and they somehow mix the two. Yep. They're fearful because they're in pain, and they're in pain because they're fearful.
Yep.
And if we as chiropractors can help them get through their pain or their fear
Yeah.
and help them on the road to recovery and get back to their health, then we've done our job.
Absolutely. That's a whole other show we could do just on the social manifestations and the way that people need the psychosocial model of low back pain.
Exactly.
I know with my positive psychology degree that I've done, that's a whole new area, is actually the psychology of chronic pain.
Exactly.
Because once people get into it, and how the fear of actually moving a certain way and their back going out again, or whatever they go through, that they have that fear inside that just, and that is what limits them. It's not their back doesn't hurt anymore. It's the fear that it's going to hurt again.
Exactly.
Yeah.
And that's a great opportunity for more research.
Yeah.
And it's interesting because the chiropractic profession is really doing more evidence-based chiropractic science.
Yeah.
And as we move along in time, people have realized now, like an example, like the Canadian health authorities have now realized that the recognized treatment now for back pain,
Yeah.
low back pain particularly, the first choice is chiropractic care.
Yeah.
It's not medical care, it's chiropractic care. Because they've shown evidence-based chiropractic, the research at our Canadian College and the Palmer College of Chiropractic and other universities and colleges around the world have shown the efficiency and effectiveness and cost saving of correcting low back pain with chiropractic care.
Yeah,
and
absolutely.
also, besides the chiropractic care, the lifestyle alteration.
Yep.
Yep.
100%. Yeah.
So in asking me what was my most unique patient,
Yeah.
I often think of a patient that came to see me when I first started practice. And this gentleman came in dragging, we're building in the office. And first, you're as a new doctor, you are the carpenter, the plumber, the whatever it takes to build your office.
Yeah.
And this fellow came in and he was carrying some wood into the office so we could build walls, dragging one leg. And so anyway, he became one of my first patients when I started practice.
Yep.
And so at that time we had our own x-ray facilities in the office, so I x-rayed his low back, and my God, I found, oh my God, he's got all these degenerative conditions. And then they said, when I was in college in chiropractic, they said, if you have to do your job, x-ray the point of pain.
Yeah.
Okay.
X-ray the point of pain.
So he had pain in his leg.
Yeah.
So I x-rayed his leg.
Good job.
Guess what? He had a very serious advanced form of osteomyelitis.
Right. Bone infection, yeah.
Bone infection. So got him off to the hospital, got him care, and Tom became a patient for many, many years.
Yeah.
For many, many years. We've had some challenges, of course, as chiropractors in making sure that we've done the best job we can. A lot of times patients expect something that we can't provide. And that's where the doctor comes into play.
Yeah.
When we say, okay, this is your problem, Mrs. Jones. We can help you to some degree, but you're going to need other care to help you through your challenges here.
Yeah.
They may have hypertension, they may be, because of maybe weight gain or something, they have a thyroid problem. So that's where we have to work in a collaborative manner with the other health professions, because no one profession has all the answers for this.
No.
And that's why I really am so proud of you to present to the world this opportunity about the world of healing, because people need to know and understand
So they have options.
there's options out there.
Yeah.
And there's more options all the time, because as knowledge expands and as we expand in knowledge and in society today, and the internet, of course, all you have to do is now Dr. Google is always there. So we always find that there's always information, and your patient now comes in, is better educated, and they ask better questions.
Absolutely.
Because they don't allow the doctor to hoodwink them into thinking that the doctor is supreme. And if the patient goes to a doctor and they're unable to find out answers, the patients are now leaving. And
go to a different doctor.
Exactly. And they're going to a doctor that listens and helps them work together to solve their health challenges.
Yeah, absolutely. That's really all you can ask for, right? It's just, it's just a patient-centric care. Excuse me. Like the patient should be the center of the care, not how much somebody knows or somebody's ego as well.
Exactly true. Yep, I agree.
So are there any other words you'd like to say to the World of Healing audience?
Well, as a chiropractor, and as your mother, Dr. Joanne, and I have said together and studied together, is that we've been so blessed to be chiropractors. Because I don't know of any other life or any other profession that allows you to go into the office in the morning and have the opportunity to meet people, to help them with their health challenges, and to see positive results.
It's true.
What a great gift that is. And wonderful training we received from the Palmer College of Chiropractic. And of course, we studied many, many years on our own, trying to improve our efficiency and our effectiveness in care. But again, it is a delight. And of course, maybe that was one of the reasons why you decided to become a chiropractor.
Maybe.
Because of the osmosis, we might call it.
Yeah,
right.
Perhaps.
Okay.
I've been hanging around you guys around the kitchen table
a
for a long time.
A long time, exactly. True.
And you guys have inspired so many other people to go into chiropractic. I think I was the 49th chiropractor that you inspired to go to school. I wasn't the first one. I know you guys got a reward. Wish it was a reward. Award at your 25th anniversary for sending the most students to chiropractic school. So
true.
As BJ Palmer always said, what you do, say, or I'm going to misquote this. What you do, say, or think today will affect the lives of millions tomorrow.
Exactly.
Yeah.
And also to light a candle.
Yeah.
And keep it burning brightly.
Better than
curse the darkness.
Yeah.
And the fun part is that both your mother and I have seen these young people who have come to us, friends of yours and people and family members who have become chiropractors, that they have lived a very good life.
Yeah.
Chiropractic, although you never become wealthy being a chiropractor, but you do allow yourself the opportunity to have a good life and reasonable health, and allow God-given health you can carry on, and be able to help people. And then people come and they say, "Oh, that's interesting. Can I do that? Can I do?" Well, then you tell them, "Yes, you can do it. You can do whatever you want to do. Get the education, get your science, go to chiropractic school, set up your practice, and do what you need to do." And we need more chiropractors in the world. We definitely need more chiropractors.
There's a lot of spines.
There's an awful lot of spines out there, and everybody needs spinal care.
Yeah.
Remember, chiropractors are the guardians of the spine.
I'm going to get a business card that says
I
that
think
now.
you should.
Well, thank you, Dad.
Thank
Dr.
you,
Dad.
No, whatever.
Appreciate it.
Thank you, honey.
Thank you so much for being on my show.
It's an honor, it's a pleasure, and we wish you well in your new endeavors with healing the world.
Thank you.
You're welcome.
And thanks for watching. We'll see you again soon.
Thank you for watching. This podcast should be listened to as educational purposes only. This is not intended to diagnose or treat any disease. Please do not apply any of this information without speaking to your own personal doctor first. If you liked what you heard, please leave us a comment or get in touch on Facebook or Instagram at World of Healing Show. And until next time, keep smiling.
Well,
Good job.
how'd it go?
Good.
You still can talk.
Still can talk. Can't take that away from you, that's for sure.